Network.com. Thank you for listening.
Welcome. This is Detailing Addiction. I'm Dr. Susan Blank, and you're listening to America's Web Radio. Today I have with me in studio David Donaldson and Michael Daly from the Atlanta Healing Center. Hi, guys.
Hi, Susan.
How are you?
I am doing very well. And I think today's topic is going to be an interesting one because it's certainly one that has been debated a lot recently. And we're hearing more and more about it. Now, probably if you're not working actively in the field of addiction, you may not have been aware of some of the controversies, some of the back and forth, some of the frankly heated discussions that go on among treatment providers.
And it goes on also among 12-step communities.
Correct. And that is our topic, which is strict abstinence-based 12-step model treatment versus medication-assisted recovery and some more evidence-based programming. So just to be clear, there is a form of 12-step treatment, not mutual self-support, not aftercare, not community recovery, which is what we consider the 12-step programs as being. There is an actual evidence-based program of applied principles from 12-step called 12-step facilitation. And this is a manualized program that was developed at Hazelden Treatment Centers up in Minnesota. And it is one that has been studied and has been compared against several other types of treatment. So we're not talking about that specifically when we talk about 12 steps. So
Right.
we need to be really clear about that. And when we talk about other evidence-based programs and medication-assisted recovery, that's a bit different. Not that they're mutually exclusive either. So it gets a little confusing in our language here.
Because the reality is most recovery programs do still encourage community-based ongoing support and as a means of helping people put together long-term recovery and rebuild their lives beyond treatment. So it's not about that so much as the treatment itself.
Right.
And in particular, when you talk about Hazelden and they're putting together the manualized version of the 12-step facilitation, they were instrumental in the big debate that we're talking about in the use of medication versus just abstinence. Because Hazelden is the granddaddy of all treatment centers in America and worldwide, and they were an abstinence-based program for years and years and years.
And what I was going to
And
say
were
was,
is the operative word.
right,
Yes.
because now compared to 30 years ago, there's a whole different philosophy that's coming through. But there are still folks in these communities with, many more years than that were brought around with complete abstinence-based.
Right.
But I think even for Hazelden, it's not been that many years since they began changing their philosophy.
Correct.
It's been in the 2000s at
Yes.
least.
Where they began to be more open to using medication to assist with individuals getting sober and getting into recovery. So if we back up a little bit and try and put some of this into perspective, at the turn of the 1900s, I guess that was the 20th century, we're now 21st century. Do I have my math correct?
Yes.
Okay, good. Back in the beginning of the 20th century, there was a lot of struggle. At that time, Americans were consuming vast amounts of alcohol. Cocaine and heroin were available over the counter. There's a famous soda created here in Atlanta that actually had cocaine in it. They don't tell you about that very much, but there was very easy access to alcohol, cocaine, heroin, and other kinds of medication that we now consider medications. And because of that, there was a huge problem with people suffering from the disease of addiction. There were all kinds of outlandish cures.
You're using air quotes.
I'm using air quotes for those of you who aren't watching this on YouTube. I'm using air quotes because inherent in many of these so-called treatments, there was actually alcohol, heroin, and cocaine in the medications themselves. And that's one thing that we have learned over the years is you can't treat the person with their substance of choice because it just doesn't work. If we could just tell the alcoholic, okay, tonight, go home, drink 5 beers and no more.
Right.
Then on Friday night, drink 4 beers and no more. And then on the next Monday, let's do 3. If they could do that, it would be awesome.
Absolutely.
But they can't.
Ever.
Ever. Does not work.
Once a pickle.
Once a pickle, you cannot go back to being a cucumber. And you cannot detox somebody safely and easily and long-term by using their substance of choice. So there was all sorts of remedies. There was all sorts of things going on. And then in 1935 in Akron, Ohio, there was the beginning of what we know of now as Alcoholics Anonymous.
Right.
And that was the first meeting of Dr. Bob, who is a surgeon, and Bill Wilson, who was a stockbroker. And they came together and they started this really quite brilliant awareness and method of trying to help people who were using alcohol get into a sobriety state and then get into recovery.
Great.
And it has worked. It still works for
Absolutely.
Millions of people.
I'm living proof right here.
Absolutely.
And it's certainly something that we still really encourage. And there's so many principles within the steps that are crucial for a person's recovery process. So nothing we're saying is denigrating the 12-step model at all.
No.
Correct.
And they were very good observers of the natural process of this disease. And the big book of Alcoholics Anonymous talks about this very beautifully, outlines, what the course of this disease is if untreated and what changes can happen and how to go about incorporating those changes in your life. And that has been truly a miracle for many people. It's grown from those 2 members to millions of members worldwide. And in cities like Atlanta, we're really lucky because you could go to a 12-step meeting any time of the day or night.
Absolutely.
And
On most any block.
and most
They
any
are all
block,
over the place.
They're free. There's only one requirement for membership.
And that's a desire to stop drinking or using.
Correct. So it is a very wonderful form of support. And to your point, Michael, there are people who that is all they have needed to get into sobriety and to stay in recovery.
Right.
There are people who have not gone to a treatment center, not gone to a detox center, have used attendance at meetings, working the 12 steps of Alcoholics Anonymous, working with a sponsor, doing service work, being very committed to their recovery and have been able to make that happen for their lives.
Absolutely.
So that's been a wonderful thing and continues to be a wonderful thing. Things have gotten a little more complicated
They have.
as we've moved on.
Well, actually, we've gotten more solutions now than we had back then because they had these kind of issues. And when you look at the history of AA, they were very clear through trial and error of what worked and what didn't work. And in AA, they really came to realize that there are issues outside of AA that are just not for them to get wrapped up and not to have opinions about. So in the founding of AA, they recognize there are medical issues and there are recovery issues, and those are separate.
Right.
But back then, the issue we're talking about today really wasn't an option. It really started becoming an option, I want to say, in the 70s.
Yes.
With methadone.
Correct.
And in the late 70s and throughout the 80s, my mom actually worked at a VA hospital, first a clinic in Savannah, Georgia, and then in Minneapolis, where methadone was the treatment for these recovering vets, a lot of Vietnam vets, who had the disease of addiction and had, in particular, heroin addiction,
Right.
and needed methadone in order to put their lives back on track and in order to live a regular, normal, productive
Right.
life.
So there was a married couple. Dr. Vincent Doyle was a psychiatrist, and his wife, Marie Niswander, who's a PhD, and they developed this chemical called methadone back in 1972. And this became revolutionized the treatment of people who were addicted to opioids. And a very important time, as you pointed out, David, because we had all of these Vietnam vets who were returning back. They had been in a horrific war situation, ready access to heroin.
Absolutely.
Many of them used heroin on a daily basis for years.
Inexpensive, cheap, and readily available.
And they were young people away from home. Most of them had not volunteered. They were there on a strict invitation from the United States government. So there was a lot of emotion around that. It was a brutal, difficult war, and lots of emotion attached to it back here at home. And these veterans were unfortunately not welcomed back as heroes, which they were, and they were not necessarily treated with respect, but many of them came back with a lot of emotional, psychological, physical wounds and addiction. And this was a wonderful answer to this problem. And
during that time period, today when we talk about the opiate crisis, it sort of encompasses medication and heroin and whatever people can get a hold of. Back then, it seemed like either you were a vet or you were an addict that had gone through the gamut of drugs and then landed with heroin.
right,
It was an end stage drug.
and
So-
it wouldn't have been used by
Nice
suburban moms or high school kids, college
kids.
athletes.
Yes.
That would not have been where you would see this particular drug showing up at that time. It was a different and somewhat hidden epidemic, really, because it was a big problem. We're going to take a break. When we come back, we're going to roll this forward a little bit and continue the debate around treatment. Thanks for listening.
The disease of addiction is a life-altering challenge, not just for the person suffering its effects, but also for the family and friends who support and love the one caught in its grasp. What should be the course of treatment? Who is the best person to render treatment? And what is the best place to go for the care that is needed? We know that you want answers to these and many more questions. Call 770-696-9862 and speak to a representative of the Atlanta Healing Center. They can tailor a program specifically designed to address the needs of the person suffering with an addiction or give you guidance as to where that help may be found. Information is the key, and the trained staff at AHC is here to assist. If you wish, you can also get more information on the website located at www.atlantahealingcenter.com.
This is Daryl Pullis inviting you to listen to America's Homegrown Veggie Show right here every Saturday morning at 10 Eastern Time. Great guests, great tips, and valuable information about growing your own vegetables, fruits, and herbs.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the trained staff at the Atlanta Healing Center address and treat every day. Their doctors and counselors with over 40 years of practice in the field of addiction can treat the suffering individual in a thoughtful, compassionate, and experienced manner and guide him or her along the path to recovery. So call 770-696-9862 and speak to a knowledgeable staff member about how you or your loved one can be helped to enjoy a better and healthier life. More information is also available on the website at www.atlantahealingcenter.com.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back. This is Detailing Addiction. I'm Dr. Susan Blank. This is America's Web Radio. And today I have Michael Daly and David Donaldson from the Atlanta Healing Center. And we are talking about the huge debate among treatment providers and people seeking treatment for the disease of addiction. And that has to do with the abstinence-only based model and medication-assisted recovery. Right before the break, we started talking about the development of methadone, which is still available and is still very commonly used, probably still the most common used medication for the treatment of addiction to opioids. Back in the day, it was the only thing, and our crisis back then was really involved with the veterans coming home from the Vietnam War and other folks who were addicted to heroin. We didn't see the prescription drug piece of it involved as much. So we had this beginning of the divide between the groups that felt like all you need is some medication, with the other groups that felt all you need is a 12-step program. And that started it. And David, you brought up a real interesting study that was done.
So right about this time, when the vets were coming back, Richard Nixon actually commissioned a study with Drs. Robbins and Jaffe, where they studied vets that were coming back, and in Vietnam they were full-fledged heroin addicts. They had been tested and they weren't able to not use and not pass a test before they came back, so they were classified as actually being addicts. And when they came back, they were able to pick up and resume their lives. They didn't go through, reportedly, major withdrawals, and they were able to just become productive citizens once they were back in their loving home communities, which led to this big classic study called the Rat Park, where they put rats, one group of rats, isolated individual in a cage, and another group of rats in this big, beautiful park where they could run around and play with all the other rats and have this great time. And in that study, the ones that were in the cage, where they had no other entertainment, would use the methadone constantly to the point of their demise. And in Rat Park, most of the rats, they never actually tell you the percentage, but most of the rats did not continue to use morphine. They went for water and they had a great time with the other rats. So the big emphasis was, if you take addicts and put them in a really nice environment and you give them lots of loving support and you give them some structure for their life, they're not going to continue to do this self-destructive behavior of using drugs. And the morality started getting put in there, and the real emphasis on, you just need to be abstinent and be a productive person, and you don't need medication to get over this disease.
So there's a couple problems with that. Both the vets coming back from Vietnam and the Rat Park study. So the first thing is, if you were to walk into, coming up in September, October, you're going to see Rush Week. If you went to fraternities, sororities on most major college campuses, you'll see all of these young people engaging in outrageous drinking behavior. They are drinking lots, they are acting out in all sorts of ways. And if you followed those kids through their sorority or fraternity path, you would see a lot of them over the years, if they managed to stay in college, you would see that at any given time, if you just applied the criteria for current substance use disorder, if we're going to use the DSM-5, you would probably see that a lot of them met the criteria.
A lot.
But then as they graduate, you'll see that there will be, the vast majority of them will be able to go get a job, get in a relationship, have a house, be productive adults, and you'll see others that drank drink for drink with their buddies. And these folks continue to struggle with alcohol, and alcohol really can become a big part of their life, and in some cases eventually take over their life and destroy their life.
Right.
The difference between those groups was not that they got exposed to alcohol. It was the disease of addiction. It was their brain. And the same, I think, is true with the Vietnam vets. Now, we didn't have genetic studies back then, and we didn't do these think of it in this way, but we all know people when the bans on tobacco became so stringent that you can't smoke in buildings and you can't smoke in hospitals and you can't smoke on some properties.
Thank goodness.
That those people who could quit did.
Right.
Even when they were 2-pack, 3-pack a day
Right.
smokers, even though they were full-fledged, heavy-duty, regular smokers, when it became really inconvenient and
Well, it was called a habit,
Right.
the
And-
smoking habit.
they added taxes to it and they made it really a problem, but most of them were able to just quit.
Just walk away. And yet we see that we continue to have around 20% of our population that cannot stop.
Right.
In spite of lots of good reasons, they truly are addicted. They're physiologically dependent, they're psychologically dependent, and their ability to stop is greatly impaired, and they need formal treatment and formal help to be able to do that. So the rat park experiment, and to your point, David, they never really said, were there still some people, some of those rats in this lovely rat utopia, that still snuck over there and drank the morphine water, or, just how many of them? And I would suspect that there were probably
2 out of
some.
10.
To somewhere between 5% and 20%.
Right.
We're still getting their buzz
still having
on.
a little something, and their compulsion to do that had less to do with their environment and more to do with their brain wiring. So I think that's a problem, but a lot of people have used that study to define it several ways. One is you need the loving fellowship and structure of a 12-step program, and that's all you should need if you work it right.
Mm-hmm.
And for some people, that's really true.
True.
And then some of our some other treatment providers' philosophy, which is that people who develop the disease of addiction do that because of trauma. That they lived in a deprived, abusive, neglectful, stark kind of environment, either literally or figuratively. And because of that, they developed this fondness of using substances to take them out of their misery. And that if you help them get over their depression, their anxiety, their trauma, then they won't need to drink anymore. So we see these various groups breaking off embracing their philosophy of what has caused the disease or the problem, because many people don't call it a disease, what has caused the problem and what is the solution for the problem. And we're here to say, first of all, one size doesn't fit all.
Absolutely.
And the reality is, it's not trauma work versus recovery work versus medication. It's all.
Let's combine.
Bringing all of these things together and realizing that you're treating a disease, but you're also treating all of these other issues that become relapse factors for people.
And what really it boils down to for me, who, I was one of those people that went through the 12 steps, worked through the 12 steps, and was able to quit drinking and not have a drink again or use a drug. But I look at today with the epidemic that we've got, and one use can mean death.
Right.
So the game is much different.
So it's interesting with when you bring up smoking. With smoking, there's not such a huge debate between social support versus medicated assisted recovery, because there's really not social support for quitting smoking. The option is you get on nicotine replacement, patches or gum or lozenges, or you can take Zyban, or you can take Chantix, and you work with your doctor, and over time you stop the smoking and then you slowly stop the medication. And with smoking in particular, that is looked at as the most successful way to quit smoking.
Right.
In fact, they will real clearly say, trying to just quit abstinence only by itself, your chances of success are no.
Well, and that's one of those things where there's also people that said, I smoked 3 packs a day, and one day I just decided, all right, this was enough, and I just quit. Well, they probably could do that with alcohol and other drugs also.
Right.
They were an abuser of nicotine, maybe a huge abuser, but they did not have the disease of addiction.
Right.
And the ones who couldn't, they were all of these medicated assisted recovery options for them that
are successful,
have been shown to be really work, and even work in combination really well.
We're going to take a break. When we come back, we'll continue the debate about different types of treatment. Please stay tuned.
The disease of addiction is a life-altering challenge, not just for the person suffering its effects, but also for the family and friends who support and love the one caught in its grasp. What should be the course of treatment? Who is the best person to render treatment? And what is the best place to go for the care that is needed? We know that you want answers to these and many more questions. Call 770-696-9862 and speak to a representative of the Atlanta Healing Center. They can tailor a program specifically designed to address the needs of the person suffering with an addiction, or give you guidance as to where that help may be found. Information is the key, and the trained staff at AHC is here to assist. If you wish, you can also get more information on the website located at www.atlantahealingcenter.com.
Live closer to your food source. Learn how to grow it yourself. Please join me every Saturday morning at 10 Eastern on America's Homegrown Veggie Show for tips and advice from the country's best gardeners.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the trained staff at the Atlanta Healing Center address and treat every day. Their doctors and counselors with over 40 years of practice in the field of addiction can treat the suffering individual in a thoughtful, compassionate, and experienced manner and guide him or her along the path to recovery. So call 770-696-9862 and speak to a knowledgeable staff member about how you or your loved one can be helped to enjoy a better and healthier life. More information is also available on the website at www.atlantahealingcenter.com.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back. This is Detailing Addiction. This is America's Web Radio, and I'm Dr. Susan Blank. Today, David Donaldson and Michael Daly from the Atlanta Healing Center are with me, and we're talking about the great debate around what is the appropriate treatment. So I think we have been clear, but let's just be real clear. The appropriate treatment is the one that the patient needs. And one size does not fit all.
Exactly.
And having the patient evaluated to look at all of the 6 dimensions that we talk about from ASAM and determining what's the best treatment plan, including medication-assisted recovery, I think is, in my opinion, is the best way.
I agree wholehearted.
It is really, really important. Not everybody agrees with that. Many places have a program, and when you as the patient show up and sign up for that program, that is the program you get.
Absolutely.
And you fit the program is not tailored to fit you. And we see this over and over again. And again, for some people, that's all they need. They just need to be taken out of the environment. They need to get some education. They need some structure in their life. And they are able to, with support from family and community, to do fine with that. So I'm not saying that those treatment programs are not successful, because they are for some people.
And there's even a change in their attitudes, because once upon a time, if a patient showed up there and they weren't interested in doing what the program provided, then they would be classified as a treatment failure and somebody who's not willing to do what it takes to get clean and sober. And now programs will simply say, that's not the kind of program we offer. If you want medicated assisted recovery, you need to go somewhere else. Even with 12-step model, there are places that if you don't want to do 12-step model, they will say, that's what we have. So if you would like to do something else, here's some other places. So at least that attitude's changing.
Which is really important, because to not have options when something doesn't fit is pretty much putting that person out to their own devices, and sometimes that is
well, that's when the worst thing happens.
correct.
When they have that fatal
Because
slip.
People who don't
Right.
recognize the disease of addiction as a disease, in particular as a fatal disease, when they just discharge somebody without options, they're just ignoring the fact that they're setting somebody up to die.
So that is, that is really important, that unfortunately, as a consumer of addiction treatment services, it is pretty hard to necessarily know what you want, what you need, but asking questions and gauging the response that you get and the attitude can often be really helpful.
Well, it's very interesting to me, talking to so many families, that many times the disease shows itself very early, and the parents basically go from one crisis to the next, depending upon what treatment center or what philosophy they've been given at that time. And it just makes you realize that this whole addiction society, we don't have all the answers yet, as a whole.
And we certainly don't have a good way of communicating it, except through America's Web Radio and Detailing Addictions, communicating what we're going for. But, with medicated assisted recovery, they've approved for alcohol a couple of different medications,
Right.
Antabuse, which has been around for quite a while, and Campril,
Right.
which helps with cravings and
Right.
helps with people putting together long-term recovery. with opiates, they've got methadone was the granddaddy of them,
Right.
and then buprenorphine, Suboxone, Subutex, and
Naltrexone.
naltrexone. So for opiates, they've got 3 different options that come in different stages of quick release or long-term release, and now they have 30-day shots for those medications. With benzodiazepines, they used to just kind of go for longer acting ones to kind
Right.
of slowly change it from like a Xanax to a Klonopin, and we realized that would just continue the abuse. And so now a lot of people are using gabapentin and other medications to help with that, because benzos and opiates are fatal,
Mhm.
potentially, and alcohol are fatal
Right.
if not treated appropriately.
Right. So you mentioned earlier as well, David, the medications. We have 7 medications that are approved for treating nicotine addiction. And I think that, to your point, that's probably the most widely embraced medication-assisted recovery substance that there is. And many people they might call a quit line. They might go to a smoke enders meeting. They might look for a 12-step program that is dedicated to nicotine. But for the most part, medication plays a big role. For many people, at least 75% of people who would be eligible and would probably benefit from medications being offered in most treatment centers today, they don't get it offered.
Correct.
Or it's only offered for detox for a short period of time. And medications like the ones you mentioned, David, are not offered as an ongoing part of a recovery program. I admit, when I was raised and trained in how do you treat addiction, abstinence was
The king.
The king. Abstinence was the way. And we didn't have a lot of these other medications, first of all. Secondly, the attitude was, for many treatment centers, developed by the person who opened the treatment center, who started the treatment center, who funded the treatment center. This is how I got sober,
Mhm.
and therefore that
This
worked.
works.
And so that's what we're going to do.
Right.
And that the fact that there are these evidence-based medications that truly do make a difference was not really considered, and is still battled over, even among physicians, about
Mhm.
whether or not to add it. But for me, the big game changer was when heroin came along. And one of the things that we're very clear about is when people are addicted to opioids and when people are addicted to heroin and fentanyl, 12-step programs rarely work, and they rarely work by themselves.
Well, and just to be really clear, when you said heroin comes along, heroin's been around for a
Correct.
very, very long time. But now heroin can be the entry drug.
Right. It's not the end stage.
It's not the end stage. It's everywhere, and probably the higher in the economic socio class as a young adult you are, the more chances you're going to be
Cross paths with heroin.
with heroin.
And that be your first drug of use. I hope
Exactly.
our listeners are hearing this. Now, yes, we have had the gradual prescription drug epidemic growing, and for many people, they started with prescription opioids, and then out of desperation or out of financial stress, or their doctor won't write anymore,
Or all of it.
they've gone to heroin. But for many of our young people,
Mhm.
it is their first drug of choice. The statistic that is quoted all the time is that 80% of people who use heroin use prescription drugs first. So 80% use prescription drugs, 20% used heroin first. And the age group, the demographics, And the number of deaths occurring in this young adult age group is staggering and continues to grow. Facing this, so yes, Michael, heroin's been around for a long time. Bayer Aspirin the Bayer Aspirin company discovered it in the late 1800s. It was discovered in Germany. It was over the counter. You could actually give heroin tooth drops to your baby who was teething. So it's been around for a long time. But this third wave of opiates and heroin in particular epidemic that we're seeing now has a very different demographic and is now considered for at least some of our young adults a gateway drug. It is their beginning drug of use.
Right. Which is it's just absolutely a game changer when you're in this field, helping people to get clean and sober, and you come across such a high number of these young people that are using heroin. And right now, the heroin is not clean. So there's a huge amount of fentanyl that's intermixed with the heroin. And it, like I said, the next slip can be your last.
Right. And when you're using something like heroin, heroin-tainted fentanyl, you have no idea what dose you're getting. Even if you're injecting or smoking or snorting the same amount that you do every time, the difference in the potency and the lethality can be great. And they have no idea.
Right.
Even if they're finding it in pill form, they have no idea if
Right.
it's a real pill or it's been pressed, or there's just not any way of knowing what you're actually getting when you get it from somebody.
And yes, many people, 80%, start out with prescription drugs. But there is a difference with heroin. Heroin is a different opiate. So heroin's proper name is diacetylmorphine. Almost immediately after you inject it or snort it or smoke it, it is converted to 6-monoacetylmorphine. One of the acetyl groups are removed and you get this particular molecule. We call it 6-AM or 6-MAM. This is a different molecule than any other opiate. And the way it affects the brain, the high people get from this is completely different.
And it's instantaneous.
Almost exactly instantaneous. The first path through the liver, that acetyl group is pulled off and you get this molecule, which itself doesn't last very long,
Right.
a few minutes to an hour or so. And then it's broken down to morphine.
Mm-hmm.
But while it's there, they have this moment of bliss
Right.
and awe and just amazement. And when they talk about it, their face lights up and they are in just heaven from that little moment that makes it worth it to them to keep trying to get it again.
So when they get to heroin, however they got there, when they get to heroin, that compulsion to use is profound. We're going to take a break. When we come back, we're going to talk about medication-assisted recovery. Thanks for listening.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the trained staff at the Atlanta Healing Center address and treat every day. Their doctors and counselors with over 40 years of practice in the field of addiction can treat the suffering individual in a thoughtful, compassionate, and experienced manner and guide him or her along the path to recovery. So call 770-696-9862 and speak to a knowledgeable staff member about how you or your loved one can be helped to enjoy a better and healthier life. More information is also available on the website at www.atlantahealingcenter.com.
Whether cruising the strip in a 57 Chevy or taking the family on a vacation in a 71 Oldsmobile Vista Cruiser, you need to tune in to Classic Cars with Steve Ronaldo and Jim Weber every Saturday from 8 to 9 a.m. on americaswebradio.com.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the trained staff at the Atlanta Healing Center address and treat every day. Their doctors and counselors with over 40 years of practice in the field of addiction can treat the suffering individual in a thoughtful, compassionate, and experienced manner and guide him or her along the path to recovery. So call 770-696-62 and speak to a knowledgeable staff member about how you or your loved one can be helped to enjoy a better and healthier life. More information is also available on the website at www.atlantahealingcenter.com.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back. This is Detailing Addiction. I'm Dr. Susan Blank. This is America's Web Radio, and we're talking today with David Donaldson and Michael Daly from the Atlanta Healing Center. We're talking about the great battle that rages within the addiction recovery community, and that's what's the appropriate treatment. To restate our platform or our philosophy, the appropriate treatment is the one that the patient needs, and that's determined through a very thorough assessment, looking at all kinds of things, including their psychiatric status, their withdrawal status, their physical health, their recovery support, their family situation, their motivation.
I was just going to say their willingness.
All of these things are very important, and to put together a treatment plan. We look at their brain. How is their brain functioning compared to other people their age? How is their neurocognitive status? Are they functioning neurocognitively as we would have expected for somebody of their age and their education level? So all of these things have to come into play. And so it's the most important thing is to know what the patient needs. But when I was trying to apply an abstinence only, as I had been trained, abstinence only model to heroin, as we talked about heroin in the last segment, it doesn't work.
Right.
People can't stay away from this particular substance long enough for us to be able to help them make the changes in their lives.
In their brain.
Well, and I think even the ones who were fortunate enough to be able to go to a 90-day program and get completely clean and have all of this wonderful work on their trauma issues and their relationship issues, when they would get out, even if they didn't immediately go back to heroin, if something happened that reactivated the disease of addiction, like they sprained their ankle and they got put on a pain medication, or they went to a party and everybody was drinking and they thought, okay, I'm a opiate addict, so it's okay if I have a glass of alcohol, a glass of wine, that they are almost instantaneously, certainly within a week, but often within the same day, back to heroin.
Right. It is astonishing. And when the medication, the buprenorphine products, initially the first one was Suboxone and Subutex, when these became available in the under the tongue or sublingual formulation, for me, this was the game changer. Because now I had the ability to get that person out of acute withdrawal, reduce their cravings to almost nothing. I could block with this medication. Well, I couldn't, but the medication could block their opiate receptors. So if they went out and used on top of it, chances are they wouldn't even get a buzz.
Right.
This was a medication that they couldn't overdose on. This was a medication that has lots of safety precautions built into it
And it made them productive.
that made them
It,
productive.
it made them able to stay clean long enough to start building back the neurotransmitters and everything that they need to start caring again.
And unlike methadone, they didn't have to every day go get their dose because
Right.
it had the built-in controls of the way it works within the brain that didn't have to be so controlled from outside forces. With methadone, they were able to get back to a productive life, but they still had to be close enough to their methadone clinic to get their medication each day. And so they were, in a sense, kind of on a leash, whereas with buprenorphine products, they're able to start resuming their life again.
Well, and I think that a lot of people have the idea that since it's a partial, that the people that are on a Suboxone or buprenorphine, they're still getting high.
Right.
And it's totally untrue.
Correct. They are not getting high, but they are having stabilization of their brain,
Mhm.
and they're having stabilization of their body,
Mhm.
and they're having the ability to attend group, to do individual therapy, to work a 12-step program. They have the ability to begin to be engaged in their own self-care. We see them making their dental appointments and getting their mammograms and doing all of these kinds of important
Responsible
things.
Adult things.
Behaviors.
Yes.
Re-engaging with their family, being able to go back to work or school, being able to be a part of their life again. And the family members say, this is my loved one back. I haven't seen this person in years. I thought they were gone, but here they are back again. And it is allowing patients to get their lives back.
The argument that's always thrown back at you is that you're just replacing one drug for another, that this person is still an addict and you're not getting to a cure. You're just getting them hooked on what you want to give them versus what the dealer is giving them.
But
How do you typically respond when?
Well, because it is different. It's different in that if we look at the third step of Alcoholics Anonymous, which is being willing to turn your will over, the patients are given very specific instructions about how and when to take their medication. They are following, most of the time, they're following our treatment plan. We're drug testing them to make sure that they're taking what they're supposed to be taking and not taking something else.
and you also have them on schedule. So they're
Correct.
not taking it to alter their feeling from 1 minute to the next. It's not a drug. It's a medication.
Correct. And it acts on their brain very differently than the full agonist that you would have if you were taking heroin or Percocet or OxyContin. It is a very different molecule, and it's a very different experience for their brain. Are they physiologically dependent on it? Yes, they are. It is an opioid. It's a partial agonist and antagonist, and that's way too complicated probably for this discussion. Do they have to have that tapered down? Yes, eventually they do. Many places use it strictly for detox to get the person from their use of heroin to their use of nothing. And that's one way it can be used. In our program, we like to work out with the patient and request that they stay on it for 13 months. This is David's brilliant suggestion, which I totally agree with. Get them through all of their anniversaries, their birthdays, their holidays, and their 1 year,
Absolutely.
which is a high relapse time for many people, and give them that time to have their brain still, to have their brain able to not be craving and looking and preoccupied with their use of drugs. So are they physically dependent? Yes, they are. Will they have to be tapered down off of this medicine? Yes, they will. Is it the sole solution? No, it is not. That's why we call it medication-assisted recovery. They also need to learn how to self-soothe. They need to learn how to manage stress in their life. They need to learn how to set boundaries, how to say no, how to ask for help, how to be back engaged and heal some of the wounds that they have and some of the wounds that they've inflicted on their families. So it's one tool. Not everybody has to have it. We do have people who are opioid dependent who choose not to be on any medication. That's okay too. Sometimes they would rather be on a full agonist like methadone. There's some risks in that, but for some people it is very helpful, and that daily accountability really does make a difference for them. And some people want to be on the complete opiate blocker, naltrexone or Vivitrol. We help them find what they need, and that is what good treatment is. Thanks, guys, for today, and thank you all for listening. We will see you next week on Detailing Addiction.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
The disease of addiction is a life-altering challenge, not just for the person suffering its effects, but also for the family and friends who support and love the one caught in its grasp. What should be the course of treatment? Who is the best person to render treatment? And what is the best place to go for the care that is needed? We know that you want answers to these and many more questions. Call 770-696-9862 and speak to a representative of the Atlanta Healing Center. They can tailor a program specifically designed to address the needs of the person suffering with an addiction, or give you guidance as to where that help may be found. Information is the key, and the trained staff at AHC is here to assist. If you wish, you can also get more information on the website located at www.atlantahealingcenter.com.
Hi, my name is Steve Ronaldo, host of the Classic Car Show on America's Web Radio, talking to you about antique car insurance. In this hobby that I've been part of for years, not all insurance companies and insurance coverage is the same. I would suggest that you call J.C. Taylor or visit jctaylor.com to find out some information about some of the best antique car insurance you can get, such as agreed value insurance for your classic car. Again, when you get ready to insure your classic, antique, or even your street rod, call J.C. Taylor Insurance or visit